You can't feel it. You can't see it. You may not have even heard of it. But a silent killer is in our midst. It is the leading risk of premature death in the world, well above smoking and infectious diseases. This killer is not lurking in a remote African jungle or in a shadowed downtown alley. It is here, in our backyards and living rooms. 1/4 of Canadians are living with this condition, more than 5 million people, and many don't even know they have it. This killer often gives no warning of its approach, attacking first and asking questions later, when it's too late. High blood pressure is the single greatest health risk facing people today, and there may be no warning signs. Hypertension's first symptom may be a stroke, heart attack, or death. Hypertension is the medical term for high blood pressure. But what is high blood pressure and why is it so harmful?
Simply put, blood pressure is the force or pressure in our blood vessels that allows the flow of blood, which delivers essential nutrients and oxygen from our heart and our lungs to the rest of our body. Over time, these blood vessels can actually thicken and stiffen, and this is often associated with an unhealthy lifestyle. So smoking, decreased physical activity, a diet high in fat and salt can cause thickening of the lining of the blood vessels, and in fact this is cholesterol and fatty plaques accumulating. This all adds up to hypertension. Over time, high blood pressure causes excess strain both on the heart and the blood vessels. This can cause damage to the blood vessels with rupture, clot formation, and blockages, which then leads to stroke, heart attack, dementia, and even sudden death.
The strain on the heart and blood vessels happens deep inside the body and may not reveal itself through any outward signs or symptoms until it's too late. The only clue may be your blood pressure measurement. Your blood pressure numbers tell doctors what's happening in your vessels and how hard your heart is working to move blood through your body. The higher the numbers, the harder the heart has to work, and the greater your health risks. Knowing your numbers is the first step to taking control of your health, and it's very easy to do.
It's really important that you know your blood pressure numbers. For example, a normal blood pressure is around 120 on 80, and in most people, the lower the better. Even in the normal range, blood pressure can increase over time, and the higher the numbers, the higher the risk for stroke and heart disease. The number of 140 on 90 or greater is considered high and needs some kind of intervention. Treatment usually begins with changes to a healthier lifestyle, followed in some cases by medications. If you have diabetes, your numbers need to be even lower. The number you need to remember is less than 130 on 80.
Getting your blood pressure measured regularly and knowing your numbers is the first step to taking control of your health. But there are many other simple things you can do to prevent and manage high blood pressure.
Do you know if you have high blood pressure? Find out how you can prevent or control it. High blood pressure, when left untreated, can damage the blood vessels in your body. It hardens the arteries as cholesterol and calcium builds up. Over time, the arteries narrow, restricting blood flow and damaging critical organs like the heart, brain, eyes, and kidneys. The first sign of high blood pressure affecting the heart is the thickening of the heart muscle. It now struggles to pump blood into the circulatory system through narrowing arteries. Left untreated, the condition worsens, and all this time you do not feel any symptoms. Over time, high blood pressure further narrows the arteries, cutting off blood to the heart. When your arteries become critically narrow, or if a piece of the blockage breaks off, it may result in a heart attack. A heart attack can cause permanent damage to the heart muscle by affecting its ability to pump blood, resulting in heart failure. High blood pressure is a leading cause of kidney failure. Damaged blood vessels in your kidney affect its ability to filter and clean blood. Left untreated, the kidney will eventually fail and dialysis or a kidney transplant will be needed. In your eyes, high blood pressure can affect the tiny arteries of the retina. Bleeding and blockage can result in blurred or lost vision. When arteries harden in the brain, you can suffer a stroke that damages brain tissue. Some arteries may rupture, causing bleeding or hemorrhage. This can result in slurred speech, paralysis, and loss of consciousness. Do you know if you have high blood pressure? Find out how you can prevent or control it. Eat healthy, relax, lose weight, and take all medication given by your doctor, and you can control high blood pressure and stay healthy.
How to lower your blood pressure. If your blood pressure is 140/90 or higher, you need to get it down. The good news is that many of the steps you can take are painless and some are downright enjoyable. You will need potassium-rich foods, red wine, a pedometer, dark chocolate, a pet, and spirituality. Step 1. Consume less sodium, which contributes to hypertension. It's not enough to just put away the salt shaker. Check food labels as well. Many prepared foods, like canned soup and frozen meals, are loaded with sodium. Step 2. Eat more baked potatoes, with the skin, plus other potassium-rich foods like acorn squash, bananas, orange juice, and halibut. Dozens of studies prove that a potassium-rich diet helps combat the blood pressure-raising damage of a high-sodium diet. Step 3. Drink 1 glass of red wine every day, but limit yourself to just 1 glass. Step 4. Lose weight if you need to. Obesity has been linked to hypertension. Track your steps with a pedometer. People who use them walk up to 2,000 steps more, which can help them reduce their weight and their blood pressure. Step 5. Get a pet. Not only does having one lower blood pressure, petting them has been shown to increase levels of the feel-good hormones dopamine and serotonin in their owners. Step 6. Eat some chocolate every day. The trick is to keep the portion small, say bite-size, and make sure you're munching dark chocolate made mostly from cocoa solids. It should taste a little bitter. Step 7. Become more touchy-feely. Research indicates that people who hug and hold hands are calmer. Step 8. Start praying. One study found that people who attend weekly religious services have lower blood pressure than those who don't attend at all. Did you know? By 2025, 1.6 billion people worldwide are expected to have high blood pressure.
Measurement of blood pressure. Equipment: sphygmomanometer, stethoscope, alcohol swab. Procedure: check care plan, pathway for client's needs, introduce self, explain procedure, and gain consent.
Hello, Barb. How are you today? Do you mind if I take your blood pressure?
No, that's okay.
Perform hand hygiene and gather necessary equipment. Ensure manual handling principles are adhered to. Assist client into a comfortable position for the procedure, either lying or sitting, with left arm supported at the level of the heart and the palm upward. Remove clothing as required to allow access to bare arm. Wrap the cuff around the arm approximately 2 centimeters above the elbow, with the arrow of the cuff over the brachial or elbow artery. The cuff should be applied evenly and snug. Palpate the radial pulse and inflate the cuff until palpated pulse can no longer be felt, indicating the approximate systolic pressure. Observe the reading. Deflate the cuff. Palpate the brachial artery and place the bell of the stethoscope over the pulsing artery. Reinflate the cuff 30 mm of mercury above the approximate systolic pressure. Slowly deflate the cuff at approximately 2 mm per beat. Note when you first hear a pulse beat. Note when the pulse beat becomes muffled or completely disappears. Deflate the cuff completely and remove it. Record and report as required. Check client comfort. Perform hand hygiene.